All right, well, it is 2:05 and Vice Chair Luke, I will turn it over to you to start the meeting. We have a quorum. We are missing Commissioner Grant, Doug Jacobs, Executive Director of Maryland Healthcare Commission, and the Secretary of Health, Mina Seshmani, the Board Chair.
Michelle, I'm here. This is
Oh, hi, Marie. Did I miss you?
I stayed off camera for a second. I'm here.
Oh, okay. Very good. Sorry I missed you. Okay, back to you, Aika, if you want to kick us off.
Yes, thank you so much, everyone. Happy Tuesday. Welcome to our February 17th, 2026 meeting. The first order of business is approving our meeting minutes from January 20th, 2026. Does anybody have any comments or questions on the meeting minutes? Any adjustments?
I can make a motion to approve the minutes.
Thanks, Kat.
And I will second.
All in favor? Aye.
Marie and Ken, I don't have you. Okay, thank you.
Great. Cynthia, did we have any public comments?
No, not this month.
Great. And Michelle, I can turn it over to you for the Executive Director update.
Very good, thank you. Well, happy middle of February, a short month, so almost the end. Happy Valentine's Day to everyone, and I hope everyone's enjoying the little bit of thaw that we had. I don't know, I hear some horror stories that we might get some colder weather this weekend. I'm hoping not. Several things are ongoing at the federal level. First and foremost, the notice of benefit and payment parameters were released by CMS. Those were just released last week. So we are digesting through them, looking to see what is going to be proposed. So we'll be working with the MIA, we'll be working with our carrier partners and really evaluating what's in there. It's open for a 30-day comment period. So we're likely to make comment, but we'll first digest what is there. From just a knee-jerk glance, it looks as though the administration is looking to make it easier to buy catastrophic and bronze plans. And of course, I think we saw people buying down because of the affordability on the richer benefit plans. So we'll take a real close look at that and monitor, what that will do for, again, consumer burden, financial burden, and for our health ecosystem in Maryland. So more to come on that. Legislative season, we are in the midst of that. We only have one bill that is being put forward, and it's Senator Lamb is sponsoring that. It's a technical cleanup bill to our pregnancy special enrollment period, which I know we've discussed before. There are other bills circulating that call upon Maryland Health Benefit Exchange to be a part of or do things as part of that bill. So we are providing feedback on that. Of course, we have to file fiscal analysis on them, and we're working with the sponsors and co-sponsors of those. The good news is that people think of us. The bad news is we have to evaluate that and see if it's something we can do, but we're always happy to do whatever we can to help Maryland move forward and bring health coverage to Marylanders. Our budget, of course, was released from the governor. MHBE fared very well in the governor's budget. We're pleased that most of what we had requested was funded, particularly around the enhanced work we'll have to do for the One Big Beautiful Bill Act for Medicaid. So that was good. Now it will go through the General Assembly. Johanna and I have been out meeting with key legislators, and educating them on the need for those funds, the work we're doing. Again, just get tremendous feedback from all the legislators we meet with, including the Senate President and the Speaker of the House, about how responsive the exchange is and the work we do, about our innovation, the technology we use. We were able to finally put in place our pilot program of using AI for case status and that is working out tremendously well. So those are the stories that we like to share with the legislators. I'm always impressed that they'll make time for us. And typically, especially if we don't have a heavy legislative list, as we don't this year, they're still willing to make time with us. And it's our annual visit to really to hand deliver our annual report and tell all the good things we do. So really happy with those meetings and appreciative of the time that we get. Open enrollment, as we know, we talked about last month in January, concluded. I gave the results of the open enrollment. I want to share today a couple of issues that we're seeing out of the open enrollment. Typically, January and February, we do see some items creep up and that we had not anticipated. Generally, they're not significant. We do have one significant one this year, and I did alert the board of this in writing. It was public. Baltimore BAL did a story on it. So I want to provide everybody, the public, including the public, an update on that. And that was a file transfer with some files for Care First. We had about 4,000 people that were impacted. And again, for all our consumers, we are extremely sorry that there was this snag in the transfer of data and getting that between Care First and the exchange. And we both are culpable of having that problem occur. So we own that. But we also own making sure that we have worked really closely with Care First as quickly as we can to get everybody who thought they had coverage into the coverage they wanted. So that's cleaned up as of last week. I think all but about 400 have been cleaned up, and those are being final. And again, our message is we don't want to harm our consumers at all. So between Care First and the exchange, we are working diligently to make sure that everyone who wanted coverage had coverage and got the care they needed. And then the other thing that also pops up this time of year, we send out the 1095 notices. That is what has to be filed with taxes to affirm that you had coverage and how much APTC you received. And typically just in the course of our business, consumers will receive that and they'll see it might not look as what they thought it was going to be. So they reach out to us and we investigate it for them. We work with a carrier, and if they need a corrected 1095 form, we'll send that to it. That's just in the normal course of business, but I've seen a couple of those come across my desk. So I just wanted to alert you to that. And if anyone's having any challenge on their 1095 forms, please reach out to us and we'll work on that and correct that immediately. Our connector entity request for applications is out, and I think that's closing this week or next week. So we are requesting applications for that grant program. So anyone interested in that, please make sure you submit your application for that. We did receive approval from CMS on the work we submitted for what are called community engagement, part of the One Big Beautiful Bill Act, which is the work requirements and the twice a year redeterminations. So we had submitted that for approval and for enhanced funding from the federal government. That was received and approved. That's terrific. And just the other thing, I talked already about the AI case status. Another little piece of innovation that we've been tracking that we put in a while ago was using AI and other technological means for password assistance. And our rate is about 86% of all the passwords that need to be reset are done so through system or AI. So we've greatly reduced the amount of folks that need to go to the call center for assistance. However, the call center is always there if they do need them. And then just one other thing on staffing, we have one opening right now for escalated caseworker, and we are interviewing for the Director of Policy and Plan Management. So those two recruitments are ongoing. And then I just want to remind the board that we will not be having a March board meeting. We'll resume again in April. So I will stop there. And if there's any questions for me, anything I did not address or anyone wants to add, please chime in.
And hi,
Michelle.
everyone. It's Mina Seishamani, having technical issues, but I'm now on the phone.
Oh, wonderful. Thank you. Mina, do you want to take over? Or would you like Aika to continue to run through the meeting?
Whatever you all want.
I am
I'm
flexible
happy
either
to do
way.
it by phone as long as you guys are okay with that.
Yes, please do.
But I guess, Aika, it's over to you anyway for the Standing Advisory Committee appointments.
It is Michelle. Oh, Joanne, I think you have your hand up.
Yeah, I just want to, Michelle, going back to the notice of benefit and payment parameters, I am looking forward to, once we've all digested and had a chance to figure out what it means for Maryland, the catastrophic plans thing, I think is imposing some changes on states that previously didn't apply, and would be interested to, be able to talk about that more in a future meeting.
And there's not a March board meeting, but we do have a meeting upcoming for the Board Policy and Governance Committee meeting, and that's on the agenda there. So we will discuss it there, and then that group can bring it back to the board at the April board meeting.
Great, thank you.
And Michelle, I wanted to confirm the April board meeting is intended to be in person, correct?
Cynthia, keep me honest on that. Is that, I think
Yes, it
that's
is, and it's going to be held at the Maryland Healthcare Commission.
Thank you. It's over to me anyways, so I'm happy to continue chatting. But thank you all again. And so I will be talking a little bit about the Standing Advisory Committee member appointments. Next slide, please. So the Standing Advisory Committee is charged in Maryland statute with addressing the broad range of policy issues that we as the board may seek input on and advice. And so to that extent, we wanted to reflect the gender, racial, ethnic, and geographic diversity of the state and constitute a diverse cross-section of stakeholders. And SAC members serve 3-year terms. The application for this particular period went out December 12th, 2026, and it closed February 2nd, 2026. The application and member recruitment process for new 2026 members was consistent with MHBE's policy and procedure. We posted the application on the MHBE website, shared with current SAC members to share with their networks, and also MHBE staff and SAC chairs conducted targeted recruitment. MHBE staff identified goals for recruiting new members to maintain the committee's reflection of the diversity of the state, and particularly adding expertise to the committee. And so based on the makeup of the current SAC members whose terms were ending and the recruitment goals for 2026, we focused on ensuring representation from Western Maryland, as well as the following specialties. So we had consumer advocacy, healthcare providers, particularly including providers or representatives from federally qualified health centers and public health researchers. And we're pleased to have recruited applications from individuals that represent each of these recruitment goals. So on the next slide. Yes, thank you. On the next slide, as I mentioned, some of our particular goals, we aim to recruit particularly around 5 to 6 new members each year. However, there were 2 SAC members whose terms ended early in 2026 due to being appointed on the board. And then we had a slightly larger recruitment goals for 2026. Aetna also left the individual on exchange market, and their representative therefore ended the membership on SAC at the end of 2025. And so myself, the board liaison, and the SAC chair, we recommended that the board appoints all 7 of the applicants to SAC, and more details on each of the applicants will be on the following slide. So this table summarizes all the applications and corresponding resumes for folks were included in the board materials. Also in the board materials is a spreadsheet that has additional context on the composition of SAC as well. And the spreadsheet included details on the 2026 applicants, an overview of the demographic and regional diversity of the current SAC members and the 2026 applicants, as well as their professional specialty. MHBE uses this analysis to track how SAC membership compares to the state's population, particularly in terms of gender, race, ethnicity, and geographic distribution, along with the targeted outreach that was conducted to recruit members that would assist in meeting our statutory goals. That SAC membership reflects the diversity of the state. And our SAC membership is tracked along with the state, as well as it's seen in the makeup of the 2026 applicants. And so MHB staff met with the co-chair, Stephanie Clapper, and myself to confirm the recommendation of all the 2026 applicants for appointment that are seen on the screen. So I'll just give folks a quick second. And so on this next slide is a request for the appointment of the new members to SAC. And I'm happy to take any questions before the motion.
This is Maria. Your first slide, the time period on the top, it says December 26, 2026. Did you mean to say 25 into February?
Yes, thank you for that
Okay.
correction.
All right, thanks.
I don't have a question, just a comment that I'm impressed by the outreach that you did and how you were able to find such a diverse and appropriate group of members to put forward to appoint. It's just, I went through and read their resumes and everything. It was just very impressive and exciting. And I think this is going to be a great addition to the council.
Thanks, Kat. No, I think it's definitely a group effort, so I share that with everybody else. But I think it was really important, especially in the backdrop of everything that's going on, to ensure that we had diversity in all the means and definitions of that to appropriately represent the needs for Marylanders. So thank you.
Aika, if I could, I want to commend you and echo Kat's comments. This is an extraordinarily gifted group of SAC potential members. And having served a number of years on the Standing Advisory Committee, I realize how important it is to the board because we give them instructions to help facilitate the needs that we have. I also want to take this opportunity to congratulate Stephanie on her new chairmanship. Another extraordinary leader. And I think we have a very unique opportunity here for the board to really engage the Standing Advisory Committee and take advantage of this talent and background.
Thank you, Ken. Absolutely. And echoing the congratulations to Stephanie, it was great for her to transition in the August, September sort of period. And so I'm happy to continue to have her leadership and also the opportunity to welcome these folks in to continue to do work and to help inform the work that we do as a board.
I can make a motion to approve the appointment of all 7 of the applicants to the 2026 Standing Advisory Committee.
And I will
Great, is
second.
there a second? All
I'll
those in
second.
favor, all those in favor?
Aye.
Any
Thank
opposed?
you.
I'm now back on Zoom. I had to reload it, so apologies for that. So I think next we move to Venkat, your the IT roadmap presentation.
Thank you, Madam Secretary. Good afternoon, Madam Secretary and members of the board. Today, I would provide a brief update to the board on our 2026 IT roadmap. Before that, I'll give a quick overview of IT and before we proceed to the other items in the agenda today. Next slide, please. To recap, what is technology for the benefit of new board members and others? When we say technology at the exchange, what we mean by that? Obviously, as the board knows, we have the consumer portal. That's where our consumers log in to seek insurance coverage. And we have the worker portal where our workers use this portal integrated with the consumer portal to support it. And we have a broker portal, we have a marketing portal, we have a presumptive eligibility portal, and there are various applications integrated tightly with these core systems, what we generally call as HBX also. And we have an end-to-end mobile apps in iOS and Android. And this is one of our flagship product. When we say end-to-end, that means consumers can come, look for plans even without logging in, and then create an account, go through the complete process, seek QHP, Medicaid, dental, any combinations thereof, until the end of the coverage, until the end of the seeking the enrollment process, which is one of the few in the nation. And we also have the CRM, Salesforce application, which is very tightly integrated to our HBX ecosystem. And just we have listed some numbers here. Since we implemented CRM, we have catered to more than 11 million consumer inquiries, averaging 1 million a year. And our recent foray into enterprise automation, for instance, we automatically, through our AI bot, verify more than 100,000 documents of consumers who are seeking Medicaid coverage. This really speeds up the consumers getting the coverage quickly and getting the response quickly from the exchange. And also it reduces the cost of determining eligibility automatically. And we, as Michelle pointed out earlier, we have an AI agent implementation integrated with our call center, integrated with our CRM system and HBX system, where consumers can directly call an AI agent response to take care of the password resets, which generally happen during open enrollment, which is one of the system hogs generally, also the call center hogs. But we are able to handle those calls, almost 43% of the password resets, just through the AI agent alone. And recently, we have also implemented an AI agent for consumers to ask about their case status, which is a very, in the subsequent slides, I'll talk about the numbers. It's a very successful initiative starting at this time. And we also have a bot, a chat bot, which we have integrated inside our portal as well as our outside our consumer portal. And since in the last 3+ years, we have provided, bot has provided more than 7 million responses to 4 million users. These responses, these channels seem to be growing every day. And we also have a live chat environment where consumers can connect to a live agent through this channel as well. And we are catered to more than 600,000 consumer live chats at this time. As you can see, this is a very comprehensive system, and it's catered to millions of consumers every year. And our core objective here is to have a system that is pretty stable, pretty scalable, and also constantly focused on innovation to be more efficient and effective also. And our IT functions listed here pretty much cover end-to-end of our, through our IDIQ, contract staffing, and our state staff. We have all these functions to run an IT organization end-to-end. Next slide, please. Very quick metrics on what we accomplished, some of those numbers here. On the top left, you see 429 total system changes. That's kind of a phenomenal number. The reason is we have almost 11 releases in a year. We call 11 major releases. So we have every release a month. And during the open enrollment period, we don't really send out a release, but we still work towards the next release. But each release has more than 40 scope items. And these scope items, what I mean by that is they may be a policy change, or they may be a system change. There may be some customization, enhancement, improvement, etc. And as you can see, this number is significantly higher compared to any state organization in the country. That gives the robust agility and nimbleness at the same time to make any system changes, any policy changes in a very rapid way without impacting the system overall, system stability and integrity. Thankfully, over the years, we implemented various controls and improvised our processes, and that's the result. This is the result of that. And we keep updating CMS on a monthly basis as to what we do and how many system changes we implement and how many system changes that we promised that we would implement in our IAPD, which is the funding documentation that we submit to CMS. And last year, we also implemented a full disaster recovery solution capability, which was never existed before. So in case of any systemic issues, let's say on MD Think or MD Benefits platform, we would be able to independently run our disaster platform in a different region of AWS. And we have successfully completed multiple times resiliency tests in 2025 before our open enrollment as well. And in terms of consumers call status inquiries, we have a number here, 8,600 inquiries. This is just in 2 weeks during open enrollment when we did the pilot. And I'm very happy to announce that last week we went live with the full product. And in the subsequent slide, I will talk about some numbers there as well. Next slide, please. So in a nutshell, HBX, our strategy is to have a very modern platform, very stable platform, and also at the same time a scalable platform. As you will see in the subsequent slides and our new initiatives such as HR1 implementation mandates, we will be able to pretty quickly scale up and implement robust policies at the same time, preserving the system integrity all the time. And our focus had always been innovation while maintaining our scalability, stability, and security. And our 2026 strategy builds on this, where we focus more on enhancing our security posture, innovation, and rapid implementation of policy changes, while at the same time ensuring our operational excellence remains intact. Next slide, please. Just to sample some of this, the way how we operate the technology is largely, you can say, these 3 pillars. Pillar 1 for the technology is ensuring operational resiliency and system security. And we continue to fortify our infrastructure and our data and ensure that any modern threats are handled safely. And we constantly improvise our systems through automation to ensure more operational excellence can be continuously realized. And our pillar 2 is driving innovation and engagement. We constantly strive to leverage new technologies, including AI, and automate our processes, removing redundancies in our processes, and also provide consumers an engagement and experience that's more easy, a little bit easier, especially when seeking complex insurance products through various responses of legal and policy questions. So that's a constant effort on our part as well. And last but not least, to be able to implement policies at scale at a very high speed is our core focus as well. The next slide, please. This is just an example on one of these pillars. So pillar 1, obviously, as I noted earlier, we have a robust disaster recovery platform in place now. This is the effort last year. We have achieved geographical redundancy as well as rapid recovery options, and also to provide uninterrupted access to consumers. So thanks to the board for approving this initiative a couple of years back. Next slide, please. Under the pillar 2, in terms of driving innovation and engagement, as I noted a little bit earlier, we continue to use new technologies. I have listed some of these specifically around AI. For example, our AI integrated Flora is providing responses more than 2.5 times compared to a couple of years back. So this is a good improvement, as well as we see the trend in consumers to seek assistance using a variety of channels, especially these modern channels. And in terms of the call center AI agent, which, as Michelle noted earlier, manage almost nearly half of our password reset calls. And also it has the potential, obviously, save costs from $8 per call to $1 of automatic processes, which is nearly $200,000 in cost savings in a year. And if you extend that for the AI agent providing enrollment status, we are seeing significant adoption. We are seeing more than 40-50% adoption in the last few weeks. And based on our prior estimation of how many such calls go to the call center on an annual basis to seek enrollment status, we estimate an potential annual savings of nearly $1 million in calendar year 2026, just from this product alone. Next slide, please. Yeah, last but not the least, the pillar 3, enabling policy and integration at scale. We did implement the Maryland Health Connection for small business last year. It's a comprehensive portal in alignment with our policy mandates. And also we work with Department of Human Services and Department of Health to integrate with the unified benefits platform, which in fact, since January, we are seeing almost 50% of adoption in terms of consumers transferred to MHBE from Human Services Department, from non-MAGI consumers transferred here to seek MAGI benefit if they are not eligible for non-MAGI. So that's a very good progress we are seeing. This provides the benefits for consumers not to do dual entry in terms of data entry or seeking benefits, and it's aligning with the state's policy on providing consumer ease of access to benefits. And last but not the least, we also implemented a hospital presumptive eligibility portal for hospital workers to dynamically apply for temporary Medicaid coverage as well. So these are some of the samples. I have given more details in the appendix. If there are any questions, please feel free to let me know as well. Next slide, please. So as for 2026 IT strategy, we have 4 core functions within this IT strategy. Number one is cybersecurity. We continue to work. This year, we are going to adopt risk standard, which is a newer standard, ARC-AMP standards, and which requires a lot of revisiting of our prior standards in terms of acceptable risk controls and other security posture. We will be working on it. This will put the agency in a better security posture the coming years. And also we will be working on certain security governance, risk and compliance platform implementations as well. In terms of innovation, we will continue to enhance our AI-powered integrations. And also we are building a data analytics platform that will be expanded to provide more predictive analytics capabilities for our policy team as well. And we are also on the final stages of our microservices architecture implementation. That will put our exchange for the next 5 years in terms of having a modern architecture for rapid changes as well. One thing, obviously, we don't want to be staying in the legacy platform, which would obviously cause more costs down the line if we ever choose to modernize these platforms. So we continue to strive to stay ahead of the current technology as well. In terms of number 3, policy implementation, HR1, obviously the implementation requirements for HR1 is a significant initiative this year, and we will be working with our partners, MDH, DHS, and external other organizations to ensure these implementations are done on time as well. And last but not the least, our 4th important pillar is the operations. We would continue to improvise our operations and through expanded intelligent automations and system enhancements. Next slide, please. So this is a quick visual. What we call as a release is every month we have a large set of scope items that go into production based on policy changes, customizations, or modernization efforts, or sometimes M&O efforts. And except during the open enrollment period, very short period between November and December, we do not have a major release. Other than that, we continue to have our release every month and make sure that we are very quickly responding to any policy needs or system needs. Next slide, please. To recap, in terms of what do we see after the end of the calendar year, we would like to see a security posture improvised through the new risk control processes, and we would potentially implement more AI-assisted threat detection response capabilities. And in terms of enhancing our systems, more AI-powered conversational assistance and simplified enrollment processes through technology to engage with our consumers, empower users, and timely and accurate delivery of federal and state policy mandates, including the HR1 changes, will be integrated. And last but not the least, we will continue to expand our intelligent automation to improve operational efficiency. This is in a very quick nutshell of what we intend to do in 2026. Any questions for me?
Okay. Again, I have a question. you mentioned data analytics, the AI components. With regard to the specifics on AWS, I mean, I'm going to dumb this down from my own experience. When we're getting updates and technology innovation, security, particularly on our computers, is AWS working to do those kind of things? And if so, how does that work with what MHBE does to keep ahead of the curve?
Thank you, Ken. That's a great question. From the platform vendor perspective, from AWS perspective, obviously, as you had correctly noted, there are numerous opportunities AWS continue to provide. It's just an ongoing options that AWS and other vendors like Azure or other vendors do that. However, on our part, we have an ecosystem of technology for our infrastructure, security, operations, and that we have embedded into the AWS system. So most of the time, we not necessarily go with what AWS is offering, but definitely there are newer technology AWS continue to offer, we continue to explore. There are many examples over the years. But our focus is not necessarily on adopting everything AWS provides us, but definitely we continue to look for technology that would tightly relate to us. For instance, our database is completely different, but it is hosted on AWS under the standards of security framework. So we continue to use that. Down the line, if we find some other product is better, we would go with that. We have already experimented with a few other products for a minor applications that we continue to do these things as well. But overall, we use AWS in terms of a platform, and which is pretty much hosted on the MD benefits platform. So largely governed by MD benefits in terms of the common technology. But we do have a certain element of this technology to cater to our specific needs. I don't know if I answer your questions completely, but in terms of, we consider the platform as a large offering, and all these plugins and products we customize based on our usage or our needs.
And that is, you did answer my question. And the reason I ask it is, I mean, AWS is ubiquitous. It's running systems everywhere.
Yeah.
And what I think when we're making a long-term, as you mentioned, 5-year commitment, substantially, even though, as you mentioned, there's potential for significant savings by doing this. I kind of want to know, is the integration component going to be able to again, to overuse the term, but to stay ahead of the curve and not be in the system? If we have to adapt to a security system, is it going to work with AWS and be efficient and we're not constantly in those legacy programs?
That's a great point. Can actually, for instance, when we are using an email platform, we have historically used a couple of products, but AWS has its own SMS product. So our question is, do we, when we initially started using those email products to automatically send consumers notifications for certain case changes, for example, do we rely on AWS platform, or do we go with the third-party vendor platform that is hosted on AWS? That's been one of the important questions for us. And the second question, obviously, is are these vendors going to be there in the long run for us? Are they going to give the capability that we are seeking at this time? So these are some of these tough questions. We have a system architecture group within IT where we ponder over these questions. We look at these technologies and adopt as we need. From a larger point of view, we don't really put all of these things in one basket, definitely. That is one concern for us all the time. We don't want to, even though the platform is the same, everything is still residing on that one big platform. But we try our best not to overtly extend our dependence on this huge platform offerings only.
Well, I appreciate that. And the reason I seem so concerned is, I mean, I commend, as a member of the procurement committee, when we were made aware, and it was timely, and I think we did all the right things, but obviously there was a disconnect between what Care First was doing and what we were capable of identifying. And that kind of disconnect, if there's ways to avoid it in the future, because it went on for, even though it was a relatively insignificant number, it went on for a lengthy time before anybody figured out this was what was wrong. So my point in asking the questions is, do some of these things that you're bringing on board and the integration with expanded AWS, does that help to avoid some of those pitfalls?
That's a great point. And actually, with respect to CareFirst and even other integrations with other state systems for us, our problem had always been we are able to do these things. The other party, can they do it? I mean, thankfully, our system have evolved to that level as compared to the other way around 10 years back. So being at the cutting edge of technology helps us to identify these issues early on. Only thing we do need to do is obviously in terms of the improvising the processes of our interactions. For example, in terms of data interchanges between us, AWS, and CareFirst, for instance. And we had numerous instances during this open enrollment when CareFirst and other carriers couldn't operate their pay now functionality properly. We were able to track it immediately because our bots are monitoring those functions and able to report us very rapidly. So we could alert our partners quickly. So it's kind of the other way around. But to your point, and definitely there are some processes we had to kind of align very robustly as well in terms of alerting mechanisms and ensuring that our partners are in line with us in terms of our expectations, and if not, how quickly we can resolve those issues as well. We have been frequently turning off, so for example, pay now functionality for carriers during open enrollment because they were not up to speed. And there were situations when their integrations were not robust, and we were able to see transaction going from our end, but there is no confirmation from the other side. So we were able to figure out all these things rapidly, but we need to hold our partners, integrators more accountable going forward to ensure these integrations work very tightly as we expected. That's one area that definitely we can improvise on.
Oh, I'm sorry to put you on the hot seat, but you gave me great answers. So thank you very much.
Thank you again. If there are no questions, back to Secretary.
Sorry, I was on mute. I was saying if no one has any other questions, then Venkat, I think you're continuing with the AWS discussion.
Yeah, thank you, Madam Secretary. Yeah, next slide, please. Oh, so coming back to the AWS discussion again, as you can see, this is a whole ecosystem hosted on this particular platform. And this is not the MMD benefits AWS platform, which is where the HBX core HBX is hosted. As you can see, MHBE also has its own AWS infrastructure, and variety of applications are hosted on this over the last 5-6 years. We have expanded this. Ken, to your point, in order to minimize certain risks, we are hosting a set of applications completely in a different AWS, completely managed by MHBE infrastructure team. This includes our disaster recovery site and all our so-called lower environments where our application development happens, and also our stakeholder site and small business portal and broker portal, and any live agent, AI agent integrations have been kept in a separate place so that if for some reason something fails at the main HBX portal, we have other application functionalities and capabilities are in place. And today, I'll be requesting the board to approve the NTE and the contract for renewal of these licenses. Next slide, please. Yeah, I would hand it over to our procurement manager, Tracy Campbell.
Good afternoon, everyone. MHBE issued what we called a request for proposal to actually renew our Amazon Web Services for a 5-year period, which consists of a 3-year base and 2 one-year options. That term consists of May 1st, 2026, April 30th, 2020 to 2031 for the 3-year base, And then option year 1 would be May 1st, 2029 through April 30th, 2030. And option year 2 would be May 1st, 2030 through April 30th, 2031. When we issued the request for proposal, we received 4 responses from 4 different offerers, and A&T Systems, Inc. provided us with the most advantageous proposal. So this is who the evaluation committee recommended, and I concurred with their actual decision. The annual costs will vary based upon our utilization, and we're going to actually come to the board each year to actually request a not to exceed amount for that particular year. Next slide. For the first year, we're asking the board to approve $2 million, which consists of a 66% federal participation amount of $1,320,000 and a state participation amount of 34%, which is $680,000. Next slide. Are there any questions before I make the requests?
Yeah, I have a question. I don't know, I didn't see it in these materials, but in the materials I read in advance, there was something somewhere about if the cost did exceed this amount, there would be adjustments to IDIQ reductions made there. Is that, I don't know if that's coming up in a future presentation here, if that's relevant to this discussion.
Could you repeat that? I'm sorry.
One of the I don't have it in front of me, but with some of the materials shared in advance, there was, I think, a statement that said if these costs did exceed this amount, the response would be to reduce spending for the IDIQ.
I think we had that covered under our budget portion under the memo.
Okay, so that'll be a later discussion.
If the need arises, yes.
Okay, because I do have a question about that. So that I should ask that question later when we discuss the budget. Is that what you're saying?
Venkat, I'm gonna turn that over to you.
Yeah, sure, Tracy. Our anticipated cost NTE for AWS is $2 million in the coming license period. However, our intent is to stay within the budget. We have never exceeded IT budget, and we always managed within the IT budget for over several years. And if it had to exceed, we'd obviously come back to the board and request this adjustment within the IT budget if necessary. For instance, if we had an excess budget in IDIQ at that time, we come back to the board and request the board if we can change these costs from IDIQ bucket to this bucket if necessary. So there is the bottom line is there is cushion within the budget if necessary to tweak it to stay within the budget. At the same time, ensure that we don't exceed the NTE. If, for example, there is a robust utilization of some sorts, for example, after HR1 implementation next year, we see a huge volume that kind of overloads our AWS systems, for example. And if need a additional NTE for that, at the time, again, we will come back to the board and lay out how we are going to manage that. So we will seek approval if necessary at that time.
Okay.
Can I say something?
Sure.
Yeah. The only thing I was going to say is, as far as this fiscal year, which is FY26, we only have 2 months because this contract starts May 1st and ends June 30th. So realistically, the impact on this fiscal year, FY26, are going to be minimal, and it really shouldn't be over. If it's over budget, it's only 2 months, 2 months, and it really shouldn't be over budget by that much.
Okay, good. Well, I know we'll come back to the IDIQ discussion later then. And then I guess my only other question is this 5-year, 3-year base and 2 1-year options customary? Seems like a long time if there's performance issues, but I'm just curious, is this the approach that's been taken in the past?
I mean, I can handle that. In the past, it's always been well, it's usually been 5-year base. We have several contracts. That's the longest we can go in the state, with the exception of real estate rent. But in each contract, there is a cancellation for convenience. So if there are performance issues, there's also a cancellation for for a reason too. So there's two cancellation clauses in each contract. So we can cancel the contract at any time, really with no reason. I mean, that's cancellation for convenience.
Okay, thank you for that clarification.
Thank you.
Are there any other questions?
Okay, if no other questions, we'll do this, I guess in two steps, the first being the first motion here for renewal of the subscription licenses. Do I have someone to put forward the motion?
So moved.
Thank you, Joanne. Do I have a second?
Second.
All those in favor?
Aye.
Aye.
Any opposed? Okay, and then the second motion of the NTE amount of $2 million. Do I have a motion?
So move.
Thank you, Yvette. Do I have a second?
I will.
A second.
All those in favor?
Aye.
Aye.
Any opposed?
Okay, thank you.
Okay. Thank you. Now we will, Venkat, it's still with you
I'm sorry, Madam Secretary.
No, it's all
One more
good.
time, but I will be out after that.
for the IDIQ modification for HR1.
Thank you, Madam Secretary. This section covers federally mandated changes under HR1 OBBBA that impact Medicaid eligibility and renewals. These are compliant-driven requirements with fixed effective dates. And myself and our procurement officer will be requesting an increase to our fiscal year 26 IT IDIQ not to exceed amount, so we can implement these changes on schedule and maintain federal compliance. And in this slide, it's shown that HR1 introduces several significant eligibility policy changes. And at a very high level, the community engagement or work requirements and immigrant eligibility modifications and a shortened retroactive coverage period, and also semi-annual redetermination instead of annual renewals that we have currently. At a high level, these changes increase eligibility verification frequency, introduce new qualification criteria, and require more frequent consumer interaction with the system to adhere to the policies. Operationally, this means more system changes, eligibility checks, more verification workflows, and more system-driven compliance controls and integration with a variety of systems. And I will go a little deeper in the next slide, please. These are just to give a high level on the stakeholders. There are a variety of stakeholders, as you can see: CMS, internal, MDH, DHS, labor, external data operators, MCOs, and others. This is a very large initiative with a very short timeline. However, we are well prepared in terms of organized, in terms of understanding the policies, in terms of translating the requirements, and having the technology team around and working with all of our stakeholders. And thanks to MDS and other stakeholders, MDS team is the leader and leading this effort. We are working very closely with all the stakeholders as well. The next slide. At a very high level, HR1 introduces several significant eligibility policy changes. Obviously, the work requirements requirement is a core change to the systems, and there are numerous exceptions around that as well. And from a policy standpoint, these mandates require holds end-to-end system changes in terms of rules changes, system changes, code changes, integrations, and certain point technology changes as well. And there are specific deadlines, and as you can see, these are very tight deadlines as well. And we are in the next slide, I'll show how we are trying to phase in these requirements into system changes. but it's a very high level, as you can see, and you probably are aware of. It's a pretty significant effort for the exchange. Next slide, please. So from the technology, what are these policies would impact, how they're impact in terms of technology, how does it translate from policy to technology? It impacts our eligibility rules engines and business logic around it, and interfaces and data integrations, various partners, and changes our consumer portal, worker portal, mobile app, and variety of verification workflow changes, and how we manage our documents, and reporting, audit controls, and data extraction, security, compliance logging, and a whole lot of integration and data exchanges. So as you can see, it's a pretty significant effort. Next slide, please. This is a preliminary schedule. When I say preliminary, the internal items can change slightly, but it's kind of a fixed schedule in many ways. The ones listed in blue are specific to work requirements, and the other in green are non-work requirements. So we after the board approves today, we will be working on these requirements to translate to technology work immediately. And our goal is to implement as early as end of March some of those key components. And I will come back to the board or send board material on a frequent updates to the board on where we stand on each of these system integrations as well. We have a very robust team internally within the MHBE technology and business. We already had a kickoff session completed a couple of weeks back. And of course, there are a lot of uncertainties in terms of how do we, for example, integrate with veteran affairs? How do we interchange the data? What kind of agreement we need to have with them, and how quickly we can have them? There are some uncertainties around it, but largely we understand the policy, and our requirements team is working to translate those requirements into technical efforts. And our technology team, architect team is already looking into how to architect some of those integrations. So we are little ahead, but this schedule is, I don't want to overcome it, but the schedule is very, very tight. But I'm very confident that we will be able to meet the deadline and meet the mandates as well. I will definitely provide more detail and frequent updates as board requires. The next slide, please. This is a high level on project funding. This is specific to federal fiscal year 26. I mean, we are kind of working between federal fiscal year and state fiscal year and calendar year and all these 3 different years for this initiative. For the work requirement changes, CMS are already approved around $4.6 million for design, development, and implementation related work for federal fiscal year. And for non-work requirements, $1.9 million for the same period. With respect to state funding for the state fiscal year, it's part of the appropriation already. And so largely we have the funding in place to start the work and continue until state fiscal year 26, and potentially 3 more months beyond that as well. And for the funding beyond that, we will be requesting CMS in the next few months through our annual implementation of advanced planning document, AAPD, including these other requirements as well, which CMS has already indicated to us that they will be approving it as quickly as possible. We did see the work requirement changes and non-requirement initiatives got approved pretty rapidly. So we are confident on receiving the funding post July, August, September also this year also. Next slide, please. This is to give overview to the board. If you look at the approved FY26 IDIQ NTE row that says current, this is the currently approved FY26 NTE not to exceed amount for the IT IDIQ resources, totals around $34.6 million. And adding the HR1 changes, funding approved, around $5.3 million. Our new NTE that we are requesting to the board for approval is $39.8 million. All these fundings here are approved. The way we would be working on the initiative is to have our existing resources, some of the core resources around architecture and development and security, to move those resources into HR1 initiative. And also we will be hiring some resources in addition to that to run our day-to-day operations and also to be a supplement for the work. So bottom line, we would meet the requirements within the budget approved, and we are requesting the board to approve the increase of $5.3 million to the previously approved NTE of $34.5 million to the new amount of $39.8 million. I'll pause here for questions before handing it over to Cheryl, our procurement officer.
And Kat, one item I wanted to note, because this is Governor filed a fiscal year 26 deficiency for these state funds. And it has moved through the governor's process, but it still is in the legislative process. So that is a risk for those state funds if the legislature came back and said they were not going to approve that. But we feel confident that we could move things around to make sure it gets covered. Is that a correct statement, Ben, Kat, and Tony? I haven't misstated that.
I would say yes, you're correct. Your statement is correct.
Thank you.
Thank you, Michelle.
Hi, good afternoon, everyone. If there's no more questions, MHBE Procurement Department will request the increase.
Wait, can I ask one question about the
Sure.
the shop implementation? Is that changes we've already heard about, or kind of future changes, the ICRA stuff or whatever? The state only funding on the previous slide.
Yeah, can you please go to the previous slide? Thank you. So this is the state only funding, Joanne. This is what we have already implemented, and there are some system enhancements that we still are doing until the end of June of this state fiscal year. But this system had been implemented. There are some enhancements that we are requested. We still have reserved some little amount for that to cover until the June, but we are staying within the budget there.
Okay.
Any more questions? At this time, MHBE Procurement Department requests the approval for the increase for the IDIQ base year and the additional 38 task orders increase.
So do I have a motion?
I'll move.
Thanks, Marie. Is there a second?
Second.
Second.
Thank you. All those in favor?
Aye.
Aye.
Any opposed? Okay,
Thank you. Thank you. Have a
thank
good day.
you.
You're welcome.
Cheryl, if I may, sorry to interrupt, the second motion also is there for increase in the 38 task order NTEs. Also.
Yes, I did them both together, sorry.
Yeah, I
but we can
mentioned
do-
it.
Thank you.
You're welcome.
Okay, I think next we move to Johanna for the strategic plan.
Thank you, Madam Secretary. Okay, I am pleased to be presenting today on our draft strategic plan for the coming 3 years, including 2026. This is our second comprehensive strategic plan. We had one in place for 23, 24, and 25 that we presented to the board when we first developed it and then provided updates over the years as we were implementing. But we've come to the end of that 3-year strategic plan. And so we've been in a process over the last 6 months or more to develop an updated strategic plan. And Michelle's just turning the lights on in my office, so I'm not so dark. Thank you, Michelle. So we've been in the process of updating the strategic plan, and we are pleased to present our draft to you today for your thoughts and feedback. And we also plan to discuss this with the Board Policy and Governance Committee next week at our quarterly meeting, with the goal of finalizing the draft next month, and then moving into a prioritization process. We have some more detailed action items that fall within the outline that we've shared, and we need to finalize those and spread them out across the years so that we have our detailed tasks to accomplish these higher level goals laid out, which is the same process that we followed for our prior strategic plan, and it seemed to work well. Next slide. So always good just to be reminded of our basic core structure here and goals, our mission of improving the health and well-being of Marylanders by connecting them with high quality, affordable health coverage through innovative programs, technology, and consumer assistance, and our vision and values, which I won't read to you, but which we kept front and center as we were working through this. Next slide. So just in terms of our overall approach, we know that it's a period of shifting ground on the federal front, some uncertainty and instability in the environment around us, coming from multiple angles. But despite all of that, our goal is to remain steady and grounded, and continue delivering on our mission of providing consistent high quality coverage and service to those that rely on us. So we kept that overall context in mind as we were thinking about what we wanted to focus on in this iteration of our strategic plan, and what is within our control and what we want to do to be prepared for things that may be outside of our control but affecting us. Next slide. So we organized this plan as we did the last version into 3 overall strategic priorities. There's lots of layers here. So we've got our overarching 3 strategic priorities. Our first one here is organizational strength. And this encompasses how we as an organization can maintain and build resiliency and continue to be efficient and adaptable. Beneath this priority, we developed 4 objectives that you can see here, and those relate to maximizing our use of resources, understanding that we are in an overall resource-constrained landscape. We want to do the most that we can with what we have. Continuing to support our board, you all's engagement and effectiveness, developing a future-ready workforce, being mindful of the changes in AI and technology and how those will be impacting us as a tech organization, and then strengthening our organizational resilience and strategic adaptability. And this really goes towards what I was saying around the uncertainty and shifting landscape outside of our control, wanting to do what we can to be best positioned to deal with that. Next slide. Beneath those 4 priorities that I mentioned among the overall organizational strength, we have identified, it looks like for each of these, we kind of symmetrically developed 3 strategies that beneath which we are classifying specific action items. And we didn't get into that level of detail here, but I just want to assure you that we don't just have the higher level strategies. We do have specific items that we are collating and putting under these to achieve these goals. So I won't get into too much detail here. I don't want to repeat what's on this slide, but we really put a lot of conversation into these and wanted to make sure that everything was well organized and in support of each higher level objective. Next slide. Our second strategic priority was around telling our story, and this focuses both externally and internally. So we were thinking in this realm of how we can use data-driven storytelling to build trust, build our influence and maintain transparency with our stakeholders. And we can go on to the next slide. From the internal standpoint, we were looking at how we can improve our internal communication, both within our departments and across the different elements of the exchange. I think every organization is always working towards this goal of minimizing silos and improving information flow, as well as building connection with our staff to our mission through different activities to communicate and model our purpose and achievements. And then more specifically here, looking at how we can use our internal intranet as a tool in this realm. Our second objective under telling our story was looking at how we strengthen externally our engagement and collaboration. So in many of these things, they're goals and tasks that we are building on. They're not necessarily new, but things we want to continue to grow in terms of positioning ourselves as a resource and partner within the state and nationally with other state-based marketplaces. Looking at where we can establish new partnerships externally to help move our mission forward, whether that's nationally or again within Maryland. And then using data to provide clear, actionable insights. We've been really building out our use of Tableau and our kind of internal skill sets around Tableau and other initiatives internally to increase our capacity to use data and data visualizations to support our engagement and collaboration. Next slide. And then our third strategic priority gets more into our policy and operations, and that is to drive innovation in our platform, products, and processes to expand our impact for Marylanders. And if we go on to the next slide, I'll speak to the detail of our objectives. The first was to optimize our core internal operations. So that's what we think about as our backend systems, our HBX platform. How can we continue to streamline and strengthen that to support risk reduction, to improve our application completion and retention rates, of course, to continue to use automation and AI to streamline our backend processes and reduce manual work for internal staff. And then related to what Venkat was speaking about in terms of our OBA HR1 implementation, expanding our use of third-party data to verify that individuals meet our requirements for enrollment in our various programs. Is there a question? Did I hear a hand go up? No. Okay. The second priority here is to enhance the consumer experience. So if the first one was more back-end internal focus system and processes, this second one is more focused on what a consumer sees when they engage with the exchange. So here we're looking at ways we can upgrade the consumer's digital experience in terms of their experience on Maryland Health Connection website and mobile app, giving consumers more clear and actionable information as they're enrolling in plan shopping, and upgrading the consumer experience as they think about which plan to choose. Expanding our communication channels with applicants and enrollees to increase enrollment and retention rates, for example, by expanding our use of texting in more scenarios. And then expanding access and improving our resolution, first touch resolution rates across our consumer assistance channels. And then our last objective, our last priority here under this objective is to grow our programs and products while maintaining affordability. And we're thinking about that in terms of how we can leverage Maryland Health Connection and continue our partnership with other programs in the state to build on our existing programs and products. For example, building on our MHC for Small Business platform to offer additional products beyond. Currently, we just have medical, and we're thinking about other products in the small employer health ecosystem that will be responsive to what we're hearing from employers and brokers. And then just 3 words, but a big one: maintain product affordability. And that encompasses our reinsurance program, the way we structure our value plans, our premium assistance programs, and continuing to innovate in how we can support affordability within the state. Next slide. So that's where we are, and happy to take questions and feedback.
I think it really elevates the exchange and Maryland Health Benefit Exchange, Maryland Health Connection in a and highlights its role in a broader capacity for increasing access to care beyond just, being that place, that marketplace, but being the subject matter expert, being a leader, being innovative. So I think it's very well done.
Thank you.
Johanna, if I could, a question and a comment. The question first, historically, how much of a living document has the strategic plan been in regard to employee work plans, evaluations, specific employee goals?
That's a great question. We have, as a leadership team, worked in our first cycle of our strategic plan over the previous 3 years to connect it specifically to employee goals and evaluations. So working towards goal setting in our as a state agency, we go through a 6-monthly formal employee evaluation process and goal setting process, and have worked as a leadership team to tie those goals to the strategic plan. And Michelle, is there anything you would want to add to that?
Thank you, Johanna. No, that's absolutely right. I mean, this is a living document, and we will come back to the board. We typically, on a quarterly basis, will report back or a semi-annual basis on the outcomes. And I realize that we should do a final wrap up of our last 3 year, because I don't think we did that final quarter. So we'll come back and do that. But it ties into everything. We have, if you look around our office, we have, the pillars by which we operate, and then we reinforce it through the PEP cycle, the performance evaluation cycle. We tie it into how we do our all staff meetings, and then we're constantly monitoring that through the leadership team, through our individual departments as well, and then reporting that back to the board. So we wanted to get this out in the draft format to you today, and we will go back, as Johanna mentioned, we'll work with a policy governance and policy and governance committee of the board, and then we'll present the final back to the board, and then we'll start tracking and we'll start reporting back on what we're doing. And of course, if there are things we want to add to it during the year, or things we realize that, this isn't appropriate for this year, we're going to push it off, we monitor that as well. So it is a very living document.
Great. And a brief follow-up comment. When you mention expanding the use of resources, just judging by the caliber of the applicants for the Standing Advisory Committee that we just approved, we have a tremendous wealth of resource, both in the Standing Advisory Committee and in the board members. I would suggest that it would be prudent to kind of look at that as a first measure of engagement. There's opportunities that I think the MHBE does that perhaps the board members are not aware of, advocacy opportunities, committee hearings, even just public appearances. One of the things that I found when I had the opportunity, there's just a high degree of trust and integrity around MHBE and the MHBE leadership. And we certainly, as board members, are proud of that and would be happy to have the opportunity to share that, share our feelings. So some of those opportunities for strategic partnerships might be right in our midst.
And Ken, under one of the priorities of supporting board engagement and effectiveness, we actually have some action items that specifically we brainstormed around how we can support the board as acting as ambassadors for the exchange. So that was definitely on our mind.
Cool.
I think I just,
Great. Well, I'm sorry.
You
I
want to
had-
go ahead?
oh, I can go after you. Go ahead, Ika.
I was just going to name something similar to what Kat and Ken elevated with the strategic priority, telling our story. I think you had mentioned this, Joanna, in the memo just around the changes in national health policy, funding structures, and the regulatory frameworks. I think that's going to be a very big one when we talk about just the fractures of trust that have imploded for a lot of people in the more recent months in the past year. And so I think there are a lot of topics I think that we've touched upon. I never miss an opportunity to talk about maternal health, for example. But there are a lot of topics that I know that we've put in our parking lot over the years, especially now with just some of the changes directly impacting immigrant populations that I think that would be really great as we think about our leadership retreat in January. Gosh, I'm moving backwards. In June, that is coming up, that we can sort of think about a little bit of just what Ken elevated around SAC, and some of those external partnerships and just other ways that we can pull some of these topics from our parking lot that are directly impacting communities as we talk about just on the backdrop of some of the changes. So I really just appreciate the work and the thoughtfulness that went into this and want to particularly highlight that telling our story strategic priority.
Great. I agree on the areas that you all are focusing on make a ton of sense. I think for the innovation bucket, I think remembering and maybe including something around HR1 implementation, because a lot of what you all are doing in the technology space has a direct implication for Medicaid and how we meet this moment with HR1 per, Venkat's presentation and, request for that, the additional funding to be able to fund it. So I would just flag maybe including something like that so that it's front and center, as that is definitely a high priority thing that we're all working on together.
Yeah, absolutely. That was on our minds, kind of woven throughout, but we can elevate that as well.
Joanne, I think you were going to say something too.
Yeah, just to echo, I mean, the thought and care that went into developing this and, looking forward to digging in more, happy to be an ambassador and be used to the fullest extent. And I like the idea of leveraging the SAC to a greater degree to help support this. It really is a wonderful group that you've recommended here today.
Are there any other questions or comments?
I have a comment. I need to make a correction to something I stated earlier. And thank you, Tamara, for bringing that to my attention. The team was working very hard while I took a little vacation, and that RFA actually closed 2 weeks ago. And the review committee, this was for the request for application for the connector entity program. The review committee will rank the applications and provide an update by close of business today. They will be reviewed internally, and award notifications will be issued by the close of business 2/19. So again, I gave some erroneous information on that and want that perfectly clear to everyone on the board and everyone listening in. And I think that's all.
I think then if there are no further questions or comments, it is time to enter closed session. So do I have a motion to enter closed session? And I think everybody should have the separate Zoom link for that.
So moved.
Thanks, Marie. Do I have a second?
Second.
Thanks, Aika. All those in favor?
Aye.
Opposed? All right. Well, thank you so much, everyone. And again, apologies for my technology issues, but now I have Zoom reloaded, so I will be joining the closed session, hopefully without issue. Thank you.